Hey guys, this is Dr. Clinton Baney, and just wanted to dive a little bit deeper into the last post that I made. It's the picture that asks, how heavy is your head? And the reason that's such an important question is because the weight of your head all depends upon your posture. If you have perfect posture, your head should weigh 10 to 12 pounds. But if you're like many people in America, your head juts forward a little bit out over your shoulders, and that increases the weight of your head on your shoulders. All of that weight of your head, as you jut forward, lean forward, all of that weight comes down onto your neck. Now, I'm going to show you on the spinal model what we should see. So on the spine here, and we'll just go to the neck. We'll talk about that today. So if I'm looking at your neck, this is front, this is back. Your neck should have a nice forward shaped curve to it. And that's just part of the normal curvature of the spine. When I'm looking at you from front to back, your back should be nice and straight. From the side, it should have three big curves. And the one in the neck here should be a nice forward C-shaped curve. So what happens over time, and it can be from our posture, it can be from our activities, it can be from our habits, it can be from overuse, from our jobs, but more and more and more, it's from desk jobs, it's from computers, it's from electronic devices, especially our phones. So in the other post, I talked about how the name of that jutting forward of the head, that straightening of the neck, is called, more and more so, being called text neck, because the weight of our head is coming down, and that is straightening out our necks over time. And we're seeing this come up in more and more young adults and children. And we're actually starting to see evidence of disc and spinal degeneration in children as young as 14 years old. Guys, this isn't normal. This is very new, and it's a rapidly worsening problem we're seeing on a daily basis. So this is what we're starting to see. And so in that picture, as people's heads jut further forward, this is what we see on X-ray. This is what we see even looking at you from the outside, looking at your posture. I want to show you what that looks like on X-ray. Okay, now here is what this looks like on X-ray. The neck is straight, and I can't tell you how many times people say, oh, I thought this is normal. I thought this is how my neck should look. And believe me, I thought that too until I became a chiropractor, and I learned the normal shape of the neck, the movement of the neck, the way the neck is supposed to hold itself, and the way it's supposed to be shaped. It's actually not like that. Now, over time, you're going to notice that you're going to start to see some changes in the bones of the neck, where they should be nice and relatively square shaped, sometimes maybe even a little rectangular. They start to become a little bit shorter and a little bit closer together. Now that happens over time because the weight of the head is shifting forward, and that's putting weight down on the front of the neck. Remember, it should have a nice C-shaped curve, and the discs, the joints, all the connecting tissues and everything are wanting the neck to be nice and curved, so that when it straightens, all of that pressure from that curve is now going to start to press on the front. And here's what that looks like on an MRI. And so you can see we have the bones of the neck in the front, the bones of the neck in the back, and right here, if you feel up along the ridge of your neck, up along the back of the neck, you can feel those little bony prominences from the top to the bottom. But the most important part is right here. This is the continuation of your brain. This is your spinal cord that runs down the middle of your spinal bones from your neck all the way down to the bottom of your spine. Your spinal cord here is being compressed upon. These little black spaces pushing into the spinal cord are your spinal discs. And those are the discs that don't look too bad here. But when we go here, that doesn't look so good. A lot of people, and I'd say about half of my patients who come to me that have these disc bulges, do not know they have them because they don't have the pain or the symptoms to go with them. Or if anything, they might have some mild pain, and we take an x-ray, we find out by surprise that the disc bulge is present. This is a problem because this is an arthritic condition and this is a progressive condition. Because of gravity, which is going to continually pull the head forward, and it's going to worsen this into a backwards curve, into a reverse curve, if left uncorrected. This is the long-term effect of poor posture. I can't tell you how many patients come into me and they have been told that they have a straight neck, but they were told there was nothing wrong with it and that nothing would become of that. But we can see right here what a straight neck can end up looking like after a few short years. And if you get in a major injury like an auto accident or a sports injury, that can increase your chances even higher, a lot higher, and that can speed up the rate at which this progresses more and more and more with each and every injury that comes along. So don't wait for that. Get yourself checked. If you have any questions, ask me in the comments below. Thank you.